Good afternoon, everyone, and thank you for joining us for our weekly update. I'm very pleased to be joined today by Dr. Monica Howe, Associate Medical Officer of Health here at the Region of Peel, Colleen Russels-Rollins, Director of Education at Peel District School Boards, Marianne Mazzarata, Director of Education at Dufferin-Peel Catholic District School Board, and Sharon Hobbin, Chair of the Dufferin-Peel Catholic District School Board. Thank you all for joining me. I hope you've all had a safe and happy long weekend. I want to once again thank our frontline workers, our police officers, paramedics, firefighters, doctors, nurses, and our My Way transit drivers who worked this long weekend so that the rest of us didn't have to. They haven't stopped since the onset of this pandemic, and they deserve our profuse thanks. We continue to closely monitor COVID-19 with an average of 10 new daily cases in Mississauga this past week. And while we have recently seen an uptick in cases in Peel region, I want to assure residents that public health have been acting quickly to trace, to track, and to break the chain of transmission. We have the capacity to swiftly respond, and that will make a world of difference in our efforts to minimize a second wave. The majority of spread here in Peel has been linked to community transmission, specifically workplace reopenings and large social gatherings. We knew that when we further reopened our economy, we ran the risk of case numbers increasing. The good news is that we've learned so much from the first wave that we are in a much better position to respond to the second wave. As we head into fall, it starts to cool down and people head indoors. So please think about dialing back the social engagements. Don't expand your bubble. Avoid non-essential travel outside the country. Consider getting a seasonal flu vaccine when it becomes available. And practice the core 4. Wash your hands, keep a safe physical distance, wear a face covering, and get tested if you have symptoms or were exposed to the virus. Please, folks, we've come so far. I'm asking you to do your part by staying apart. On that note, I want to thank the province for acting quickly to respond to the rise in cases across the GTHA by hitting the pause button on any further loosening of restrictions when it comes to public gatherings, expanding social circles, or the further reopening of businesses. This is the right decision at the right time and will help all of us ensure a safe return to school. Speaking of back to school, I am joined today by both senior leaders of the Peel District School Board and the Dufferin Catholic District School Board, who will be welcoming thousands of students back to classrooms over the course of the week. I had the opportunity to join parents, students, and educators this morning at Metropolitan Andre Elementary Catholic School to wish them a great first day back. You can tell that the students were excited to see their friends again, to be back at school, but maybe not so much in the classroom. Parents are understandably have mixed feelings and mixed emotions about the return of their children. They're relieved but a bit nervous what the school year may bring. It's going to take some time to adjust to our new normal, but I know our educators and our public health officials are doing their best to ensure the health and safety of all students. If there is a confirmed case, public health will spring into action to isolate, conduct contact tracing, and implement strict infection prevention protocols. If there's a case of COVID-19 in our schools, kids will not return to the class until it is 100% safe to do so. I'm confident in the health and response plan that has been put in place. And I want to thank the school boards for working alongside public health experts to keep our kids safe. We also have to do our part to help keep COVID out of our communities so it doesn't make its way into our schools. But before I turn it over to Dr. Howe, I'd like to provide you a brief update on a number of city facilities that recently reopened. As of yesterday, We reopened our recreation centers, our fitness centers, our indoor pools, arenas, and City Hall to a limited capacity. This includes council chambers and committee rooms, which have been fully outfitted to ensure your safety. I encourage residents to please show up to our facilities with an appointment and a plan. You can check hours and availability at mississauga.ca/recovery or by calling 311. Finally, I have some good news for our local bar and restaurant owners. We've officially extended patio season right here in Mississauga. We recognize the impact COVID-19 has had on local restaurateurs and bar owners, and we're doing what we can to keep our customers coming through their doors, which is why we are extending our city's temporary patio program to November 15th for those businesses who have already secured an extension through our temporary patio program. I'm sure we will see patios transform into a winter wonderland this year with blankets and seasonal drinks to keep customers cozy and warm. I, for one, am looking forward to enjoying my first hot toddy of the year at my favorite local pub. And with that, I'll now turn it over to our Associate Medical Officer of Health, Dr. Monica Howe, to provide us with a brief update.
Good afternoon. My name is Dr. Monica Howe, and I'm the Associate Medical Officer of Health here on behalf of Dr. Lowe, who's taking a very well-deserved vacation this week. I will be providing an update on the increase of COVID-19 cases in Peel Region and speak about Peel Public Health's collaboration with schools in Peel Region for a safe reopening. To date, Mississauga has had around 3,100 cases of COVID-19, of which around 350 are active, and around 2,800 are recovered. There have been 229 deaths in total. Over the past week, from August 31st to September 6th, we've had 350 cases of COVID-19 in Peel, of which 23% reside in Mississauga and around 75% in Brampton. This is an increase of cases in Peel at levels we have not seen since June in the latter phases of stage 1. Overall, in the last week, we've seen a large range of the number of cases from the low 30s up to a high of the low 70s. Another notable trend is the age breakdown of the cases as we continue to see younger age groups make up the largest proportion of COVID-19 cases. Our cases in Peel include 73% that are younger than age 50, with those in the 20 to 40-year-old age range making up 40% of cases, and specifically those under the age of 19 at 17%. Since stage 2 reopening, we have seen a steady proportion of cases that are community-based and may have been acquired from large social gatherings. But we've also seen an increasing proportion of cases in the same households, an increase in those due to travel, as well as a number of workplace outbreaks. With this increase in cases, it is even more important for everyone to continue practicing the core 4 behaviors. Those include staying apart and remaining true to your social circle, continue to socialize outdoors with people outside of your social circle while maintaining physical distancing, washing and sanitizing your hands, masking up, and getting tested if you have symptoms, and staying home. As I mentioned, work outbreaks continue in our region. I know that many people would like to learn more about where these are and which companies are affected. Peel Public Health would release the names of businesses if there was a risk to the public and we cannot adequately contact trace contacts. This is why there are precautions in place at public locations such as gyms and restaurants to keep contact information for patrons to assist with our essential work of contact tracing. Now I'd like to focus on the reopening of schools. I know that for parents and guardians with children returning this week, that the news of an increase in COVID-19 is concerning. I am now going to outline what Peel Public Health is doing to support a safe school reopening. We have worked very closely with both of our school boards to prepare them for the reopening, and that means that the school day looks a little bit different. In elementary school, children's social bubbles may be restricted to their entire class, and they spend the entire day together, including at lunch and recess. For high school students, this may be alternating between online and in-person learning, and staying within a small cohort of 15 students. This week, our school boards have limited attendance with a focus on teaching students health and safety protocols. Peel Public Health is also hiring and using our existing school health nurses to assist schools with infection prevention and control measures and rapidly investigate cases of COVID-19 in schools and contact trace those who may have been exposed. To date, we've had 2 lab-confirmed cases in Peel schools, and we're able to work with our school board partners quickly to notify close contacts and recommend testing as needed. Any confirmed cases of COVID-19 in a school will be communicated to the school community. Our advice for parents or students in school include screening for COVID-19 symptoms every morning and getting tested if there are any symptoms. If your child is tested, we recommend the entire household remains isolated until such time that the student's test results is back. Practice wearing masks at home and pack enough to ensure that your child has a backup. Have a plan in place to pick up your child from school quickly and an emergency contact in the event you can't pick up your child. Teach your child the key moments for hand hygiene before and after masking, going to the bathroom, and eating. Lastly, downloading the COVID-19 app so you can be quickly notified of any exposures to COVID-19. Thank you for this opportunity, Mayor Crombie. I wish parents, students, and school staff all the best for a smooth transition in this first week back to school. Thank you.
Thank you, Dr. Howe. As you can see, the stakes are high, and we must remain laser-focused on our efforts to limit a second wave this fall. Given it's the first week back at school, I wanted to welcome the leadership from our local school boards to join me today to provide parents and students with an update on what they are doing to ensure students are ready and prepared for the year ahead. With that, I will now invite Colleen Russell-Rollins, Director of Education at the Peel District School Board, to say a few words on behalf of our public school boards.
Thank you very much, Mayor Crombie, for inviting me today to share an overview of the Peel Board's reopening plans for the 2020-2021 school year. In a typical school year, today would have marked the second day back at school for all students. But of course, as we all know, this isn't a typical school year. Ever since the closure of schools in March, the COVID-19 pandemic has impacted the lived experience of students, families, and staff members in different and significant ways. We've all had to adjust to this new normal, including the way we teach, work, and learn. The Peel District School Board's commitments to equity, human rights, and eliminating anti-Black racism through improving teaching practices and revising the procedures that create systemic inequities remains steadfast. This focus has even greater urgency given the inequalities that COVID-19 has created. Staff in the Peel District School Board are ready to welcome back students for this new school year, whether they're returning to learning in person or online. We've missed students tremendously. We recognize that the decision about whether students will return to learning online or in person has been a difficult one for many families. That is why the Peel District School Board's return to school plans will be adaptable to meet the needs of families, students, and staff amidst the ever-changing COVID-19 pandemic. At the heart of these plans is health, safety, and the wellness of students and staff. As a district, we embrace this new opportunity to establish an online school that offers engaging and supportive learning experiences for students in kindergarten to grade 12. At this time, approximately 40% of elementary students will be learning online, and 20% of secondary students have chosen a fully online learning experience. Over the past 2 weeks, there have been examples in the media and on our website of the new health and safety protocols and routines that have been put into place to keep our schools as safe as possible and to limit the spread of COVID-19. Some of the procedures include mandatory masks or face covering requirements for all staff and students in grades 1 to 12, adapted timetables so classroom cohorts stay together, enhanced cleaning and sanitizing, and coordinating movement throughout the school and the sharing of resources among students. Those are some of the new routines our students will be learning this week as they return to school and reestablish relationships with staff and with their friends. Class sizes are top of everyone's mind to allow for physical distancing in addition to mask wearing. The Peel District School Board has used additional funding in the board's reserved funds to reduce elementary class size averages at our physical school locations. We've also reduced class sizes in those neighborhoods with the highest incidence of COVID-19 and high on the Social Vulnerabilities Index. It is our foremost belief that a healthy school is an investment in a healthy and prosperous community, and conversely, a healthy community is the only way our schools can be healthy. We must stay strong together. We continue to work closely with our local public health partners, Peel Public Health. This includes developing a coordinated plan to help contain and reduce the spread if an individual at a school tests positive for COVID-19. Please watch our website for updates. While there are certainly differences to this school year, there are also a lot of things that really haven't changed. That includes our unwavering commitment to ensuring that learning is engaging, relevant, rigorous, and respectful of our students' identities, and that all students have viable options post-secondary. We look forward to another school year filled with wonderful opportunities for each student to learn and grow. Thank you.
Thank you, Colleen, for updating Peel parents on the measures you are taking to help keep our kids safe in the classroom. I'd now like to invite Sharon Hobbin, Chair of the Dufferin-Peel Catholic District School Board, to provide an update on our Catholic Board.
Thank you, Mayor Crombie. Good afternoon. I'm also very happy to be joined today by our Director of Education, Marianne Mazzarato. So thank you to Marianne for joining us. This week, the Dufferin-Peel Catholic District School Board will welcome back 79,000 students to our 151 schools and remote learning classrooms. Our staff have been working diligently, getting ready to welcome back our students for a safe re-entry to school. For many community members, especially our parents and guardians, it has been a challenging and very stressful time. We want to assure them that our first priority is to do all that we can to ensure the health, the safety, and the well-being of their children and our students. In this regard, we have implemented ministry and public health approved health and safety protocols within our schools, including adhering to physical distancing, following directional markers and signage, proper hand washing, wearing of masks, entering and exiting school, and proper movement within the school. Our staffs have been meeting regularly with representatives of the Peel, Wentworth, Guelph, and Dufferin Peel health officials. The Dufferin Peel Catholic District School Board has shared its Return to School Guide with our parents, as well as a video on health and safety protocols with parents this past week. Both these resources and other information is available on our board website at www.dpcdsb.org. Elementary students from kindergarten to grade 8 will attend school one day this week, starting today, and then Thursday and Friday, based on their surname in alpha order. Secondary students in grade 9 attended school on Tuesday or Wednesday this week, and grades 10, 11, and 12 will attend school on Thursday and Friday this week based on their assigned cohort. Much of this first week back in school is focusing on health and safety protocols and school orientation. For those in remote learning, class placement and coordination will start this week with a focus on routines and expectations. We have approximately 70% of our students in class, with secondary a bit higher. Local public health authorities will monitor and respond to symptoms of COVID-19. Students and staff who exhibit symptoms of COVID-19 will be immediately placed in a very special health room designated by the school, and the parent guardian will be required to come to the school and pick up their child. Persons who have been confirmed to have tested positive through the public health process will be prohibited from attending school until they're cleared by our public health officials. Persons who test negative will be able to return to school once there are no symptoms for 24 hours. We as a Catholic community comprised of trustees, board staff, our parish priests, with the support of parents and guardians, each in respective roles, will do our utmost to support each student as we start a new school year in a new kind of learning environment, but one that we want to make sure is safe for all of our wonderful students. Thank you and God bless.
Thank you, Sharon and Colleen, for joining us today and for your commitment to ensuring that nothing short of the best when it comes to our students' success this year. And now we're prepared to take questions from the media for either myself, Dr. Howe, or any of our school board officials.
Mayor, your first question comes from Ashley Ford at Mississauga. Ashley, please go ahead.
Hi, Mayor Crombie.
Hi, Ashley.
Both of my questions today are actually for Dr. Howe.
Perfect. I'll bring her aboard.
Thank you. Go ahead.
So earlier today, the Premier appeared at a press conference, and he said that if certain hard-hit regions and cities are really concerned about an uptick in cases, he specifically mentioned Brampton and Toronto and Ottawa. He said that the mayors and public health officials there are free to either roll back some of the loosening of restrictions or, do any closures as they see fit. I kind of wanted your thoughts on that, and if you think that that's kind of the best approach to allow regions and cities to decide whether or not to roll back or maybe tighten some restrictions, or if you actually think it would probably be better to do it across the board throughout the province.
So thank you very much for the question. I think for some context around the latter part of your question around how the regional approaches have taken place, certainly with a reopening approach, there was a lot of collaboration and discussion both within the local GTA health units along with provincial partners at the Ministry of Health to discuss the best approach. We did advocate for a regional approach because we wanted to ensure that cases within our particular region were declining at a rate that we felt would be safe to do so. With the question of whether or not we need to now roll back on some measures, I think we would take a very similar approach. In speaking to our colleagues amongst the GTA health units, we do know that there is a lot of movement within the GTA, both within people who work or live in different parts of the region. So I would want to certainly collaborate again within the neighboring health units, along with our Ministry of Health colleagues. We have been giving them daily updates at the Ministry of Health on the situation in Peel, and we have seen a fluctuation in the range of cases due to a number of factors that I mentioned before. So certainly we are keeping those conversations going on a daily basis, and we'll bring council members as well as continuing those conversations with our colleagues.
Thank you. And I was also wondering, so it's been said, many times, you mentioned it today again, and it's been said a lot over the past few weeks that it seems like a lot of the uptick that we're seeing in certain cities is related to social gatherings, workplace outbreaks, cases spreading in households where a lot of people live together. So it seems like, there's been, calls to close bars and gyms and restaurants, but if cases aren't necessarily coming from those places, would the region of Peel maybe consider in the future rolling back social gathering limits? Because I know right now it's 50 people indoors, 100 outdoors. If the numbers continue to tick up and the region was worried, do you see Peel Public Health recommending that maybe outdoor gatherings be scaled back to maybe like 25 people indoors or less people outdoors? Is that kind of an action you can see yourself taking over, recommending that certain businesses be closed?
Certainly, we would want to evaluate all the potential options. With the scaled reopening, there were certain phases to certain businesses and outdoor limits, as you say. The current outdoor and indoor limits are designated by the province, and we've worked very closely with the municipalities, for example, to put even further restrictions on, say, restaurants. So the restaurant limit at a particular table, for example, has been passed through bylaws through our various municipalities to a limit of 10, which is more restrictive than the province, for example. So we would certainly look to examine the options for reducing that scale back in concert with our local municipalities as well as the province.
Dr. Howe, I have another question for you from Isaac Cowan from the Pointer. Isaac, please go ahead.
Hi, I would like to ask a little bit about the workplace transmission. Both you and Mayor Crombie mentioned it. I know you said that you would release the workplace details if there was a threat to the public, but I was wondering why there's no sort of database or anything in the same way there was for long-term care, given that really in the way the public interact, workplaces which have outbreaks are probably more relevant to them than long-term care institutes.
And that's an excellent question. And so with long-term care homes, there are certainly institutions where people have their loved ones, as well as some of them are publicly funded as well. And we are concerned about those interactions. And the activity that's going on in long-term care. With workplace, under the privacy considerations, there's a number of factors to consider, and that is our ability to effectively contact trace. Peel is home to a large number of industries and large number of workplaces, and these are effectively contained to the employees who do work there, and we are able to get those contacts quite readily. There are a number of implications for privacy reasons under which individuals who work at a particular workplace may be more easily identified as an employee, but also considerations around the impacts to that business's livelihood should the name become public when it was not necessary to do so to reduce public risk.
Okay, and my follow-up is both for yourself and Mayor Crombie, if possible. I want to pick up on the Brampton question again and the number of cases in Brampton versus Mississauga. Is there a danger that if restrictions are rolled back in any way in the future by Peel Public Health, Mississauga will be brought back to stage 2, for example, along with Brampton, or would you try and separate that out? If I could get your view and Mayor Crombie's, please.
Sure, absolutely. I think what's key to note is that our region is very closely linked, not only within Peel region, but also with the other GTA health units. And that is movement of people who may live in a particular place, and therefore the case count is reflected in a certain community, but they may actually work in a different place. So we would need to have more considerations and conversations together, and certainly happy to continue those conversations with our local municipalities.
Thank you, Dr. Howe, and thank you, Isaac, for the question. I think it is an important question, and I think what you see across the GTHA, specifically and especially in Peel, is that people live and work seamlessly across the borders, and we know that the virus knows no borders. That said, we have made great strides in Mississauga, and our case numbers don't warrant a closing, so I'm very hopeful that Mississauga will remain reopened. We did see there was a precedent in Windsor, Essex, where Windsor went into phase 3 and the Essex region was held back. We've made great strides. Our cases averaged 10 this week, 7 last week, and even fewer the week before that. So there is a small uptick. However, I know that Mississaugans are very diligent and they're following the Core 4, and I'm very hopeful that we don't have to revert back to phase 2. And we will obviously consult with Peel Public Health, who will be consulting with the province and their counterparts there before we make any of those kinds of decisions. Thank you for the question, Isaac.
Mayor Crombie, your next question comes from Steve Fenwell from Mississauga News. Steve, please go ahead.
Hi, Mayor Crombie, how are you?
I'm very well, Steve. How about you?
Thank you. Council today, just changing gears for a second,
Okay.
Council today talked about ranked ballots and referred to discussion on setting up a citizens committee on the matter. And you outlined a few reasons why ranked ballots may not work in Mississauga, including as they may not boost voter turnout based on outcomes of a recent London election. But if that citizens committee does recommend ranked ballots for the next Mississauga election, would you be open to that possibility?
Yeah, thank you for the question, Steve. So certainly if we appoint a citizen, we go to make the effort to appoint a citizen committee, we would be very receptive to their views. We would point out the additional costs, and it was in the range of over $500,000 to implement ranked balloting in London. It did not increase any voter turnout. In fact, it decreased from the previous 2 elections. It's very complicated, and the results were not known that night. They weren't known in most cases till the next day, and what I'm being told is it wouldn't have changed the outcome. So on that basis, I personally don't support them, but if we implement a resident committee, certainly we would take their advice. I'm quite certain my council would heed their advice. Thank you, Steve. We're getting a little bit of feedback. Steve, are you still there?
Yes. Sorry, I was hoping to ask a question for Dr. Howe.
Yes, absolutely. I'll invite her to the podium.
Please go ahead.
Hi, Dr. Howe. You said that for privacy reasons, among other reasons, you wouldn't disclose kind of where the workplace with the most recent kind of large breakout was in Mississauga. Can you kind of clarify how this outbreak is not a risk for the public, and under what circumstances a workplace outbreak would be considered a risk for the public?
So thanks very much for the question. So just to reiterate, in case of the feedback, it was with this particular, we've recently had a large workplace outbreak in Mississauga, and around the privacy reasons for that. And so we are able to effectively contact trace all of these employees and notify them. And as such, we are reducing the risk to the public by testing and isolating these contacts immediately. So that has reduced any risk to the public in that way. And in the event that we have a setting that has, for example, not kept good records, and we are not able to effectively contact trace because a particular business has not kept records of their patrons or who has been in a certain setting at a particular time, then we would consider releasing that information at that point.
Thank you, Dr. Our next question is for Colleen and Sharon from the school board. It's a specific question from Metroland Media on the policies of the school board.
Which school board?
Catholic,
I think they said. You can clarify when you get to the podium, it was Catholic.
Sharon from Metroland Media, please go ahead.
Hi, Sharon. My name's Karen Martin Robbins, and I'm calling from the Caledon Enterprise. How are you today?
I'm fine, thank you. How are you?
I'm great, thanks. I was wondering if the school board found that a lot of parents were switching from in-class to online learning in the last week, and if so, how did the schools in the Dufferin-Peel Catholic District School Board cope with that?
Oh, thanks for the question. I do think that as the closer that parents came to the day that they're to take their children to school, that there was some rethinking that went on. We are seeing more parents moving to the online, and so we are now in the middle of reorganizing the online, because that means, they're put into classes, etc. I think that some parents may be reacting to the reports of numbers, et cetera, from our health departments as well. But parents have a right to either bring their children to in-class or to go online. We are prepared to offer either modality, and we are also have a commitment that if they were to move back to one or the other, that they would be in the same area in terms of the curriculum, that there shouldn't be a lag on one or the other. I'm hoping I'm answering that question.
Yes, thank you very much.
You're welcome.
Is it possible to have Colleen also answer the question?
Thank you. Yes, we've noticed a similar trend. Recently, families have decided to move from in-person to online. It is our foremost goal to stay connected to all of our Peel District School Board families, recognizing that this is a very difficult decision for families to make, and many are making sacrifices themselves within their families to accommodate whatever choice, whether it's in-person or online learning. And so, like Sharon explained, we are adjusting our classes to accommodate students who might be moving from online to in-person or in-person to online. We will continue to adapt as much as possible. We are asking parents, however, to make a decision by the end of the day on Thursday, so that we are able to pay careful attention to our class sizes both online and in our physical schools. There will also be additional information about the point at which parents can choose to make a different decision for their children in October, and so we really encourage parents to stay connected with their local principal, as well as to receive updates from us through email, and to find further information on our board's website. We are embracing the options that our parents make for their children, and we look forward to providing a rigorous and respectful education to all Peel families and students.
Thank you.
This concludes today's press conference. On behalf of Mayor Crombie, I want to thank everyone for participating, including our guest speakers. Have a great day and stay well.
Thank you. Thank you all for joining us.